Order. Oh, sorry. I call this meeting to order. This is the Standing Committee on Health. I'm John A. McDonald, the chair in the MLA for Hants East. Today, we will have agenda setting. Just a reminder to please put your phones on silent. Now I'll ask the committee members to introduce themselves, just stating their name and their constituency, and I will start with MLA Regan.
Hi, Kelly Regan, MLA for Bedford Basin.
Rafa Di Costanzo, MLA for Clayton Park West.
Burrell, Halifax, Shabukto.
Susan LeBlanc, MLA for Dartmouth North.
Nolan Young, Shelburne.
John White, MLA for Clay Spain Dominion.
Chris Palmer, MLA Kings West.
Danielle Barkos, MLA Chester St. Margaret's.
And for the purpose of Hansford, I also recognize the presence of Legislative Counsel Gordon Hebb on my left and Legislative Committee Clerk Judy Kavanaugh on my right. Okay, so we're in agenda setting. So everybody's gotten a list of their items. When we're finished, we should have, I'll give it to you just as soon as I finish, but as soon as we're finished, we'll have 6 topics, 3 PC, 2 Liberal, and 1 NDP. Mr. MLA Burrows.
Thank you. I would like to move that we amend the proposed witnesses sheet we have in front of us by, in the final NDP proposal, moving the bottom 2 proposed witnesses, the College of Physicians and Surgeons of Nova Scotia and the Nova Scotia Regulated Health Professions Network, up to the top Liberal proposal, which is the protection of health data, and then remove from this sheet the NDP proposal, access to and protection of personal health information.
So just to be clear, yeah, just to be clear, what you're asking is that if I pick the witnesses onto it, you want to add the College of Physicians and Surgeons of Nova Scotia and the Nova Scotia Regulatory Health Professionals Network to the Liberal topic of protection of health data.
Yes, Mr. Chair, and this is with the agreement of the Liberal caucus.
And then to strike.
Yep.
And then to strike, yeah.
Okay. So, MLA Di Costanzo.
And we're in total agreement that it's similar topics, so we have no problem with that.
MLA Palmer?
Thanks. The PC caucus is fine with that decision.
Okay. So, all in favor, aye? Aye. Contrary minded? Motion carried. Okay. So, we'll start back off. So, we'll start with the PC caucus. MLA Palmer.
Thank you, Chair. I move that the first topic for the PC caucus be promoting physical activity. Our suggested witnesses will be representatives from the Healthier Tomorrow Foundation, the Department of Communities, Culture, Tourism, and Heritage. Our second topic be the integrated youth services, and our suggested witnesses will be representatives from IWK Health, Integrated Youth Services New Glasgow, and Integrated Youth Services Halifax, YMCA. And our third topic be advanced diabetes care, and our witnesses will be representatives from the Department of Health and Wellness and Nova Scotia Health and IWK Health.
Okay, thank you. MLA Regan.
Hi. First of all, I think we normally do one topic at a time in this committee, but I'm not a long-term member of the committee, so I could be wrong on that. The other thing is, the second, we don't have a problem with the topics except for the second topic. This program, the locations were announced in April. I don't think they're actually up and running yet. It indicated that the sites will be up and running in January, I think, of next year. So we might be jumping the gun on this particular topic at this time. It seems to me that is a worthy topic once we actually have some of the programs actually up and running and we know what they actually do and we know what the numbers are and that kind of thing. Sounds like a great plan, but it just doesn't. It seems like we're jumping the gun because there is no there yet. There's an announcement and nothing more.
Okay, thank you. In one second. So I just confirmed with the Ledge Council that there is no set for it. The same thing as if I was to call when Mr. Burrell had it. And so I'm going to say it's not out of order. It may not be common, but MLA Regan.
Also, since we appear to be doing this in a conglomerate, I would add because we don't have anything in the Valley for that integrated youth services one. And again, I do think we should be voting on these separately because the government is going to use their majority to insist that we take a topic that is not actually up and running yet. And so it doesn't make sense to me, even if we drew this out and did this as our very last topic, that would be December. And that's before the first one's open. So it doesn't make sense to me at all to include that in there. And I suspect that's why it's been done this particular way, to have three together so that you get one in that there is no there yet. We have an announcement and nothing else. I would
MLA
also
Regan, February.
February?
February. We have 2 more meetings, July and August.
They don't
This is
start
6.
until January.
So
Yes,
this,
they
I'm
don't-
just letting you
yeah.
know, this would be, if it was at the end, it would be February, not December. Just
So they don't open until next year.
okay.
So there's nothing there to actually do this. It doesn't make sense, and we have 6 topics here. So I guess we have another topic already chosen. Do we?
No, we have 2 more topics.
Oh, I
So-
see.
So,
Okay, okay,
sorry.
yeah.
So when I
So we
took over
literally-
chair, when I took over chair, I wound up trying to get this done earlier, so we didn't have the block. So we have 2 more months. July and August are scheduled. So the next one would be there. So apologize. That's why I said only thing I corrected was February. MLA Regan.
So, I do think that if we're going to do this topic, which it appears we are going to, because the government will use their majority to insist that we take a topic that doesn't exist, for a program that doesn't actually exist yet, it'll be difficult to question them about anything substantive about the program and how it actually works, because we won't know because it won't have opened. But there's nothing there for the Valley, for example. So I would suggest that we add to it the portal for the Valley, just so we have some input from an organization that might in the future be able to offer these services, or could speak to what services are needed. But we don't have anything there from the Valley at all. Or I do note that there will be locations in Cape Breton, so perhaps we could add those in there too. And the other thing is advancing diabetes care. I think in addition to the Department of Health and Wellness, it would be most appropriate to include the Canadian Diabetes Association so they can give us their perspective on that, since they are sort of most closely associated with people who are dealing with this particular disease.
So MLA Regan, is that a motion, or are you asking? So
Yes.
you're moving.
That,
That's why we need to separate them. So
So that's why we need to-
Order. MLA Regan.
so to MLA Barkhouse's comment that it is a word salad. No, it is not a word salad. A word salad is when you just throw a bunch
Order
of bud words.
through me, and let's deal with the motion. So MLA Regan. So
Yes. So my motion is that we separate these topics, because we have concerns about some of them.
okay. So just a sec. So your motion is to separate these into 3 separate motions.
Yes.
Okay. So MLA Young. Well, your point of order is MLA Young.
Yeah, we already have motion on the floor for these topics, so we'd be putting a second topic out to break the topics out. We have a motion on the floor.
So as I thought, that the motion to separate them is in order. It's a votable one and it's a debatable one. Yep. MLA DeCostanzo.
Sorry, I've been on this for 5-6 years. We've always done them one topic at a time so we can discuss what needed. So I don't know, why is it such a big deal that, and as you see what happened, the confusion is because we're going from one to the other. We always, say one, and if you have anything to say, and then when that is finished, then you move to the second topic. So I think you're complicating life for no reason. We can just do it the way it's always been done.
No. Okay. MLA Palmer.
So, Mr. Chair, I mean, there is precedence for other committees that do the motions like what I did today. But I guess in the interest of working with the committee members, I'm just one other point I would like to make is that I thought you ruled that the how I said the motion was in order originally.
Yeah. So
Right?
just to be clear, MLA Palmer, your motion was in order.
Yep.
The motion to separate them is also in order.
Yep, okay.
It'd be similar as a motion to table or whatever. So if the motion passes, it will be separated. If the motion fails, they'll stay together. That's.
So Mr. Chair, we'll go back and we will do them one at a time to get them finished.
Okay, so that will require unanimous consent to remove it, or just vote onto it to make it?
Just vote.
Okay, so we're going to vote onto it versus, okay. So all in favor of splitting them into 3 separate motions. All in favor, aye. Aye. Opposed? Motion has it. So Emily Regan, I'm going to allow MLA Palmer to restart with the first one, so I'm going to give him the floor. MLA Palmer?
Mr. Chair, I move that the first topic for the PC caucus be promoting physical activity. Our suggested witnesses will be representatives from the Healthier Tomorrow Foundation and the Department of Communities, Culture, Tourism, and Heritage.
Any discussion on that? MLA Regan?
I'm wondering if we could have someone from an organization that deals with physical disabilities, so we can talk about, how that works for a good segment of our population that doesn't actually have access to or the ability to do a lot of the physical activity that most of us sort of take for granted. So it could be, it could be Easter Seals, or it could be Disabilities Nova Scotia, or a group like that is dealing with physical disabilities.
Is that a motion, MLA Regan, or?
Yeah, I'm
is
just
it
trying.
discussion?
I'm trying to find the right organization. I know I'm not.
MLA Palmer wants to say something, so I'll let him while you're searching. MLA Palmer.
Mr. Chair. So, Mr. Chair, this is a targeted topic that we feel that we've done some research on, and we feel that the witnesses that we put forward can definitely speak to this, and I don't think we'll be adding any more witnesses. So I call the question, please.
MLA Regan.
Maybe the Disability Rights Coalition of Nova Scotia could speak to what it's like to try to promote physical activity when you have difficulty moving. And so I would put their name forward.
So you would move to add?
The Disability Rights Coalition of Nova Scotia.
Any discussion? All in favor, say aye.
Aye.
Opposed, nay? Nay. The nays have it. Any other discussion? All in favor, I'm just making sure. Okay. All in favor of PC topic 1? All in favor, say aye. Aye. Contrary, nay? None. Emily Palmer.
Mr. Chair, I move that the second topic for the PC caucus be integrated youth services. Our suggested witnesses will be representatives from the IWK Health, Integrated Youth Services in Glasgow, and Integrated Youth Services Halifax YMCA.
Thank you. MLA LeBlanc.
Thank you, Mr. Chair. I think this is a great topic, but I just wanted to flag that if it is true that the services, those programs won't be up and running until January, that perhaps we just make a note that we should schedule this one last.
The clerk has made note. MLA Regan.
And just to speak to MLA LeBlanc's point, when this program was announced in April of this year, the release from the government says site selection is currently underway and the first sites are expected to open in early 2025, with others opening over the next few years. So it's not currently up and running. So I just want to make sure we're using our time to the best, and this could be something that we could visit sort of further along in our topics.
MLA Palmer.
So, Mr. Chair, we're very happy with the ability to be able to have representatives from these the witnesses that we've called, that we'll be calling, come in and speak to the plans that are ongoing, how will be rolled out. I think it'll be a great opportunity for committee members to ask the witnesses when they come here, the process and how things will be going forward with this program. And I know that there's activity in some of the other areas that I'm sure the people who'll be here will be able to speak to all of that, Mr. Chair. So, and there's no one saying that maybe in the next agenda setting or down the road we'll be able to actually call for an update on this as well. So we think it's an important topic that needs to be addressed at that time. So, and I would agree with MLA LeBlanc's recommendation.
Mm-hmm. Thank you. Thank you, MLA Palmer. Anything else? MLA Di Costanzo.
I am sorry, but I disagree with my colleague, because when they say first site expected opening early 2025, that could be May, could be this. How can we ask them question on something they have not achieved, have not talked, nobody's enrolled, there's no stats, there's no cases. What are we asking? It's embarrassing. I'm sorry. And it says, with others opening over the next few years. You need a couple of years for them to have worked, to have done something, so we can ask them questions. It's premature for them and for us. It just doesn't make sense to me, unfortunately. Sorry. And I would like to table this.
And I was just going to say, I only need one of you to table it because I think you both read from the same document.
Yeah.
Thank you. All right. All ready for the question? Yes. All in favor? Aye. Aye. Contrary-minded, nay. Okay. MLA Palmer.
Mr. Chair, I move that the third topic for the PC caucus be advancing diabetes care, and the witnesses will be representatives from the Department of Health and Wellness, Nova Scotia Health, and IWK Health.
MLA Regan, I saw her first. Then I've got you, MLA LeBlanc.
Thank you. I think that's different from what we had. We just had the Department of Health and Wellness on our sheet, I think. But thank you for adding some other ones to it.
On this one. So which was it totally? Sorry.
Well, when I first...
Oh, sorry. My bad. MLA Palmer. And I'll get to you.
In my previous attempt at my motion, I actually did mention all of the witnesses in there. So I'm not sure, but
well, no, I think
the witnesses are the Department of Health and Wellness, Nova Scotia Health, and IWK Health.
So, yeah,
oh, okay. So what MLA Regan is pointing out is the sheet that we're looking at only had health and wellness.
That the clerk might not have had.
So that's okay. So the point is, it's those three. So MLA Regan, I'll give back to you, and then. Oh, MLA Regan.
Well, thank you. I'd like to make an amendment that we, in addition to those three witnesses, that we add the Canadian Diabetes Association.
Okay. Any discussion? MLA LeBlanc.
That was going to be my suggestion as well. So I just want to say that I support that amendment. I think it is important to hear from the people that are on the ground doing the work in the community with folks who live with diabetes.
Okay. All in favor, say aye.
Aye.
Opposed, nay. Nay.
Hanson wants you to say whether the motion is carried or not.
Oh, I apologize for. I forgot to tell Hansard when the motions were carried. That's my apology. So that motion was defeated. Now we're back to the original witness. Any other discussion? All in favor, say aye. Aye. Contrary minded. Motion carried. And for Hansard, I apologize. The next topic is MLA Regan.
So I want to make sure that I have this all right. The topic is protection of health data, and it's been sort of rolled into the one from the NDP, so access to and protection of personal health information. And the witnesses would be the Deputy Minister of the Department of Health and Wellness, the CEO of Nova Scotia Health, the Deputy Minister of the Department of Cybersecurity and Digital Solutions, the College of Physicians and Surgeons of Nova Scotia, and the Nova Scotia Regulated Health Professions Network.
That's, well, Any discussion? All in favor, aye. Aye. Contrary? Motion carried. MLA Regan, that's what I was waiting for, to see who was going to put their hand up.
Thank you, thank you. Our second topic would be reasons for doctors exiting the Nova Scotia health system. And the witnesses we'd request would be the Deputy Minister of Health, the Office of Healthcare Professionals Recruitment, Nova Scotia Health, and Doctors Nova Scotia.
Okay. MLA Young.
Yeah, thank you. Thank you, Mr. Chair. I believe, like, if I'm not mistaken, we've just done this topic in March. I think it was under a different name, perhaps impacts on labor shortages. Like, this topic just happened. The witnesses are the same, and it's like a couple of months later. So, I mean, we've just done this topic. I won't be supporting it at this time.
Okay, and I'm just having the clerk double check. MLA Regan, while the clerk's checking for me.
What we did have is recently a report come out on the reasons why doctors are leaving the Nova Scotia health system. There were, in fact, exit interviews done with doctors, and so we now have more information than we would have had in the past about why doctors are actually leaving here in Nova Scotia, why they're leaving the system and where they're going, etc. So I do feel that although the topic, I mean, it's probably a topic that gets done every year, right? We do have new information, and I think it's important for the committee to deal with new information when we have new information. If it was just the same old, it would be different, but we do have new information now.
Thank you. MLA Young.
Yeah, and just to MLA Regan's point, you know, maybe it is a topic that's revisited every year, so I'd be happy to look at it again in the next agenda setting. But as for now, no, we just did it in March.
All in, ready for the question? All in, MLA Di Costanzo.
Did Ms. Kavanagh find it on the list?
Yes.
Is that the same?
Only reason is because MLA Regan was, I had it and handed it back to her. MLA Regan had looked it up, I just didn't comment. So on March 19th of 2024, impacts of labor shortage on the healthcare system, the witnesses were Nova Scotia Nursing Union President, Doctors Nova Scotia President, representative from Nova Scotia Health, Office of Healthcare Professional Recruitment, and a representative from the paramedics. So that happened on March 19th. Just like MLA Di Costanzo has the floor.
Sure. Yeah. This is totally, it's a segment that was not focused on. We're focusing on a specific thing, is exiting of doctors. That wasn't the meeting that we had in March. Okay. Totally not, and we have information, and we would like, this is our topic. We know it's important. We are losing more doctors than ever. There is 125 or 130,000 without doctors, and we need to know why they're leaving. That's very important to us. So I'm sorry, this was not discussed in March.
MLA Regan?
And it was a general topic. It was over a 2-hour period. It dealt with all kinds of different health professionals. This particular one is about doctors, and it's about doctors leaving. Not about doctors coming in, it's about doctors leaving. And it's directly the result of the report that did come out about why doctors are leaving. It is not about paramedics. It is not about the nurses. It is not about any other allied health professionals, all of whom are important and necessary to our health system. This is about the doctors that are leaving our system. And if you look at the Nova Scotia Need a Family Practice waitlist, when you look at who is on that waitlist, when you ask those people why they are on that waitlist, 55% of the people who are on the wait list for a doctor are there because their doctor retired, is retiring, or has closed their practice. It is a separate topic. It is a subsection of a topic. It was not dealt with in a full manner the last time that we met back in March on this particular topic. We have new information, and doctors leaving the system accounts for more than half of the reason why we have 158,000 people plus on the doctor wait list as of May 1st of this year, because we don't have the numbers, sorry, April 1st of this, May 1st, we don't have the June numbers yet. So it is of concern to Nova Scotians, 158,000 of them who do not have primary care. And we should be dealing with this topic. If we don't, it's an attempt to sweep this under the rug. We have a report that tells us what is going on right now, and we should be dealing with this in the Health Committee because our primary care physicians and our nurse practitioners, they are the gatekeepers of the health system for most Nova Scotians, and that's how most Nova Scotians get in the door, and we need to hear about this topic.
Thank you. Emily Young.
Mr. Chair, we got a lot of work. There's been a lot of work happening around Dr. Prootman and stuff. We've just done this topic with the same witnesses in March. We could fundamentally disagree on this, but I think it's a great topic to come back, as MLA Regan suggested in the next agenda setting. I'll call the question if I can, Mr. Chair.
Any other discussion? All in favor of the motion? There's only one motion, which is yours, which is for the status of surgery. There's been, otherwise I would have said amendment, so on your motion, all in favor say aye. Aye. Contrary minded, nay. Nay. Motion defeated. Oh, actually, you were correct.
Oh, okay. Oh, right. Yes. All right.
Okay.
MLA Regan.
The status of surgeries in Nova Scotia. And we, as witnesses, we would call the Deputy Minister of the Department of Health and Wellness, the CEO of Nova Scotia Health, Doctors Nova Scotia, the Nova Scotia Nurses Union, and the President, of NSGEU.
In Emily Young, Emily Palmer, I'm being told.
Mr. Chair, I think this is a very important topic, and I think to my colleagues' point about priorities and what's important to our constituents, I'm sure we all hear from constituents around their surgery and times and different things, and I think it's going to be a great topic for us to bring forward, and we're willing to support this topic.
Any other discussion? Question. All in favor say aye. Aye. Contrary? Motion passed. MLA LeBlanc.
Thank you, Mr. Chair. I would like to propose the following topic to add to the agenda: the barrier-free access to contraception for Nova Scotians. And the witnesses would include Access Now Nova Scotia, the North End Community Health Centre, a representative from Wellness Within, the clinical director from the Rose Clinic, and the Deputy Minister of the Department of Health and Wellness.
MLA Regan.
Make a friendly amendment to the list of witnesses that we include someone from the Halifax Sexual Health Clinic.
Okay, so just
We don't do friendly amendments, correct? It's an amendment.
okay, MLA Regan. I just wanted to get confirmation. It's an amendment, so you're amending it. So it requires a vote. A friendly amendment in my previous world, you didn't need to vote. So you're moving to add them. Okay. Any discussions on the amendment? Okay. Oh. No, that's why I just paused just to make sure. All in favor, say aye. Aye. Contrary minded, nay. The amendment is carried. So now the amended motion. Any discussion? All in favor, aye. Aye. Contrary minded, nay. Motion passed as amended. So now, okay. Emily Palmer, you take it.
I'd like to call a recess, if I could, for 2 minutes. Is it possible to have a recess?
Yeah.
Well,
Or we'll wait till the correspondence.
the only thing left is correspondence. Okay. So, Emily Palmer, are you good? Emily Palmer.
Yeah. If I could take the 2-minute recess, Mr. Chair. Or we want to,
Okay,
we do
I'll
it
give
after.
you, I'll give you a 2-minute recess, so you'll be in recess until 1:33, which I just gave you 2.5. So we're in recess till
Okay.
1:33.
Thank you.
Friendly amendment's just a term for someone saying, I really don't disagree. Decided.
Yep, okay. Order. Okay, so we're going to deal with correspondence. May 29th, 2024, we received an email from Teresa Cunningham, Strongest Families Institute regarding Nova Scotia Standing Committee Health Witness request. Is there any discussion on this? Emily Burrow.
All these 3 letters in little different forms are requests to appear before the committee, and so they all seem to be based on the misunderstanding that access to the agenda of the Health Committee comes through in a general appeal to the Health Committee. I wonder if it wouldn't be helpful to ask the clerk to respond to these letters and explain how the agenda is established, that it is made on the recommendation of caucuses, so they would know about that in the future.
Okay. Do I need a motion for that?
Or consensus or motion?
Okay, so I'm going to see what MLA DiCostanzo, I saw her hand go up quicker than you, it could have been I, says DiCostanzo.
We agree with our colleague, but we also feel that if we can tell them that they can appear at caucus meetings first, they can request to go into the PCs. We have caucus meetings where we have presenters, and that's the first appearance. And then if we feel that this is a topic that we need to bring at committee, then we will. But they have the opportunity to present to the PCs, to us at caucus meetings.
And the NDP. I don't
And,
forget.
sorry, I apologize.
I don't
I
forget.
meant it
See?
for all 3 caucuses, of
Okay.
course.
MLA Regan?
They may well be valuable witnesses in future topics. I went through and looked at them. They all have something to say, but I agree with my colleague that if they make presentations to the various caucuses, they'll be at top of mind when we're choosing our topics list, and then they can be added as witnesses when we have topics. I think they're just sort of thinking maybe more about the federal system and how they may deal with topics or something.
Okay, so just so what the Ledge Council is informing, we could let them know they have the opportunity to request it. We would not, obviously, as committee, say you're going to meet with them. So I just want to go back to MLA Burrell because it's his motion. And are you okay, MLA Burrell, on how it's worded with that, and then the point that they're able to reach out to all three caucuses if they wanted to? Okay, so I just wanted to make sure that since it was your motion, and just if that works with your intent, I don't need an amendment onto it if that kind of fits your intent. So, and we're calling that a motion.
I see the clerk looking puzzled, so perhaps she may wish.
So the clerk, please.
Yeah, I'm not sure what practice you want me to change. I mean, when people approach me about sending a suggestion to the committee, I always encourage members of the public to send any correspondence they want to the committee. I also suggest that they might reach out to their local MLA or to any of the three caucuses. So I do make that clear when they ask me.
Okay, so from the sounds of it, Ms. Kavanaugh, that's already in place today, where you're telling them that that process. So
yeah.
is
already what the intent of Ms. MLA Burrell's being done today?
I think so. I mean, if they simply send a letter with no questions, then I say thank you for your correspondence. I'll pass it on to the committee for their discussion. Frequently, though, they call me beforehand and say, "What's the procedure here?" And I give them their options.
So considering that that's the current process, MLA Burrell, do you want to remove your motion with unanimous consent? I'm just asking.
Yes, that makes sense. I was only concerned that each of the three letters asks for a specific thing, which is not the current practice.
Yeah.
So I think it's important that the response should clarify that for people who correspond. That's all.
Yep. No, perfect. Emily LeBlanc?
Yeah, I was just going to say that I think that the one thing that was not described in the clerk's explanation is that like a very clear sort of explanation of how topics are selected at this committee, which is that caucuses put forward topics that are then debated, and so therefore, if an organization wants to, be considered, then they need to go through the caucuses.
Yeah. Okay. So I'm going to allow. Well, I'm going to allow the clerk to vote or discuss it, and then we'll vote on this. So,
yeah, sure.
Emma, or sorry, just demoted
Ms.
you.
Kavanaugh.
Ms. Kavanaugh.
I guess, in the past, committees have scheduled meetings based on suggestions from members of the public. And on our website, on the legislature's website, there is a page describing for members of the public, how to request a meeting. If you want to appear before the Standing Committee on Health, here's what you do. So if you don't want to receive unsolicited letters like that anymore, should we remove that from our website?
Okay. So first, I think we should deal with unanimous. Do we have unanimous consent to remove MLA Burrell's motion? All in favor? Aye. Anybody object? It's a move, so that way there's no motion sitting on the table that I got to remember about. So, Emily Burrell, are we good with how the clerk is doing it now? We're probably still going to get some letters, but she'll keep reminding them that the process is to go through the caucuses. Emily Burrell, apologize.
Yeah. Well, the clerk has pointed out a larger problem. That's a bigger administrative problem of discontinuity between what the website says and what in fact happens. I'm not meaning to address that big problem. I'm meaning simply to address the little problem.
Perfect.
That people have had a misunderstanding in these 3 letters that in response we could correct.
All right. Thank you, MLA Burrow. Okay. So I'm going to just point out the other 2 letters for the record, so at least they're on the record. So we also received...
And I have one more question for
Oh,
the committee.
sorry. Ms. Kavanaugh, please.
When I do receive letters like this, then intended for the committee, I mean, I always pass on every bit of correspondence we get. Would you rather have me run interference? Do you want me to get in touch with the person who sent the letter and say, listen, I suggest you approach the caucus instead, or shall I simply pass it on to the committee and let them decide how to deal with it?
Emily DiCostanzo.
I think you can suggest to them to go through the caucuses because there's more likely for their topic to be picked if they have explained the situation to all 3 caucuses. One of the caucuses will pick it up.
MLA Regan.
With that in mind, though, I think it is important for all of us to see what comes in here. I think it's good information that comes to us, and we might, our caucus may deal with something, and we may be away that day or something. So it's good to have it here. I like seeing those come through, and the committee appreciates them, reaching out to us. This is how it's done, but we're really pleased that you sent us this, et cetera, right?
So status quo. Thank you. Okay, so the second letter we received, May 31st, 2024, letter from Colton Profit, Mental Health Commission of Canada regarding MHCC, Nova Scotia Health Standing Committee presentation request. Is there any discussion? Seeing none. And the third letter, June 5th, 2024, email from Marie Kavanaugh, no relation? No relation. Regarding AI powers early diagnosis, how artificial intelligence is helping physicians diagnose skin cancer, and accompanying June 6th email from Amy Levy, melanoma early detection funding. Any discussion on that either? Emily DiCostanzo.
I'm very interested in this, and I would be happy if the Liberal caucus would be the first one that they present to. You can let them know.
No. Okay, so is there any additional business? Okay, MLA Palmer.
Thank you, Mr. Chair. So would like to go back and, if we could, revisit our the third topic that the PC caucus put forward, and a suggestion that was made by my colleague, MLA Regan, in regards to adding a witness.
So what you want to do is undo a motion that already happened, so that will require unanimous consent for us to actually deal with that. So do we have unanimous consent to have the Canadian Diabetes Association, that's who it is?
That's correct.
That motion to deal with it?
That's correct.
All in favor, aye. Aye. Contrary? You have unanimous consent, so move your motion.
Thank you. So, Mr. Chair, I move that the third topic for the PC caucus be advancing diabetes care. Our suggested witnesses will be representatives from the Department of Health and Wellness, Nova Scotia Health, IWK, and the Canadian Diabetes Association of Canada.
Any discussion on this? All in favor say aye. Aye. Contrary minded? Motion carried. I don't know if that's an amendment. I'm saying it's a motion. Okay. Any other additional business? Any other witnesses? So, MLA Burrow.
Make a point on the order of the committee.
Yes, sir.
It seems to me that the system we have of the government caucus bringing forward 3 topics, the official opposition 2, and our party bringing forward 1. This seems to me to be a very good system. The system is not that the official opposition brings forward 2 and the NDP brings forward 1 topic if we should have the permission of the governing side. So we are not bringing forward topics asking, may this topic be, would you please allow us to consider this topic? And if you have some concern about the topic that you don't like about it, that it would be disallowed. We are presenting the topic as the topic which we, as of right, as a party with standing, wish to put before the committee. So I think that core understanding of the committee's operation is not always in practice, and it would be important for us to remember that.
So,
Thank you.
MLA Young?
Yeah, no, I was just going to add, I mean, even today, there was combined topics and stuff like that. Like there was things that seemed to function today. And it's not about asking for permission, you know.
So, MLA Regan?
Well, with respect, if that were the case, we would be hearing about doctors leaving the province. That would have been chosen. That was our second topic that we put forward. So that's not how it happened, and that's not how it's supposed to happen, is my understanding. You get 3, we get 2, and they get 1.
Your choice.
And there happened to be another one on the sheet, and I guess what I would say to my colleagues is, in the future, what we won't do is put forward 3, we'll just put forward 2, and those will be the topics, and that'll be it. Because that's the way it's supposed to work.
MLA White?
Thank you, Chair. I would ask, did it work that way when you were in government? Probably not.
Okay, order.
Probably not.
Order. MLA White. Through me. Regarding the discussion.
Thank you, Chair. Perhaps you can answer that question. This committee, when the topics are voted on and approved, they become the topics of the committee, of all members. When we bring witnesses in here, we speak to them as a committee. So I think we're supposed to have a say in what topics go forward, as you do with ours. It's the same thing. You get to make motions on ours, and we approve them or we deny them. Just because we have a majority, it's a reflection of the House Assembly as well. It's the same thing. I just don't understand why this is a concern now when it hasn't been before. The topics go forward as a committee. We are members of the Health Committee. That's who we are, and that's what we speak on these motions. So I think we need to have a say in them.
Thank you, MLA White. MLA DiCostanzo.
I'm sorry, we just witnessed where we presented to you that a topic you brought forward that hasn't even started, that the program has not started and won't start till, and we pointed out something that's so clear, but you insisted to keep it because you have majority. But something that, for us, there was a topic that is happening with a report, with a change, and you canceled. So I'm sorry, you're contradicting yourself by what you just said. I'm sorry.
Okay. MLA Barkhouse, I seen her hand first.
I'll be honest. You can't push and pull. So saying you want to change hours is okay, but us not wanting to have any kind of conversation about yours or any kind of change of yours is not okay. So I don't understand that. And you've seen at this table, at this meeting here now, that there has been suggestions of adding and taking away witnesses and putting topics together. And we actually thought MLA Regan's idea over our one topic was a great idea for adding witnesses. So I'm just saying you can't have both. You can't say it's all right to change ours, but it's not all right to change yours. This is what this committee is about, is picking topics together.
Emily Palmer, did you have? No. Yes
No,
or no? Emily?
Yeah, well, the only comment, I'm not even sure my colleague, MLA Burrell, is suggesting, but to MLA Barkos's point, when the topics are put forward, there is a discussion. There's a debate. There's a discussion around, like my colleague said, adding witnesses, taking witnesses away. So, just because, to my colleague MLA White's point, just because we have majority reflective of the House doesn't take away the principle that we're trying to get across here. So, anyway.
MLA White.
I just can't sit here and allow it to be said. We voted down a topic that was discussed 3 months ago. 3 months ago. I think that's pretty fair. Done.
Emily DiCostanzo.
Unfortunately, we disagree. We have new information, new report. I don't remember asking one question about that in March. I have questions I wanted to ask with new information. So we disagree there, so please let that one go. It's just, I don't remember, and I've sat on health committee on many committees, that a topic, as my colleague from the NDP mentioned, we choose the 2 out of the 3, as they choose the 1 out of the 3, and you tell us which ones were allowed and which one is not. That's what happened today, and that I don't remember it ever happening, but I could be wrong.
So Emily Burrow, as the chair, I will have a conversation with Mr. Hastings, because I believe he's the one who's deals with the committees, and have a talk to him about that, just to see if I'm misunderstanding it. If it's only reason I'm looking at Mr. Burrows is because Emily Burrows brought it up, and if so, I'll report it at the next one if that's agreeable to you. Okay, Emily Regan.
I see all points here. I will say there is a difference between voting down an entire topic and adding a witness, and so we did see some collaboration here on adding witnesses, which I do appreciate. But I will say that an important topic was voted down by the government, and it was our second topic. And so that is the issue. It isn't that we add witnesses, because I think that's an established norm. But putting forward a topic of great importance to Nova Scotians.
Yeah. So Emily Burrow, just to be clear, you understood that's the topic I was going to talk to Mr. Hastings about, right? Which is the point that it was voted down onto it. Correct? Emily Burrow. I just want to make sure that you, when I said I'll do that, I meant ask the question on that. So.
Yes, Mr. Chair, I have not made a motion about this.
No, but you brought it up, so I will ask the questions.
Yes, I just wanted to register a comment on the proceeding of the committee, that's all.
Yep, and I'll ask because I've only been sitting in this chair, and I'll talk to Mr. Hastings. So, see no other discussion? The next meeting is Tuesday, July 9th, 2024, from 1 to 3. It'll be the the Cancer Screening Program. Witnesses, Nova Scotia Health Cancer Care Program, Nova Scotia Breast Screening Program, and IWK Health. This meeting is adjourned.
Thank you.
Thank you. So Danielle.